Welcome to the Hank Cisco Show, ladies and gentlemen. Don't touch that remote. Got a show here today. It's about your health. And I have a doctor here that was born and raised here in Norristown, practicing in the Norristown area. And when I was a policeman, he was one of my safety patrols out there, the Holy Savior,
That's right? Holy Savior.
And talking about that, the chief of police, Bono, is now the sheriff, we got the fire chief. They were all safety patrols, But, so now Dr. Samuel Puleo, he's doing safety too. Now he's a surgeon, and he operates on knees and hips. And let me tell you, I have a lot in common with him. He operated on my 2 hips, okay? And just about 3 weeks ago, I had pain in my back. I had pain in my hip. I don't know, what's going on? I thought maybe the hip replacement was acting up, about 8, 9, 10 years ago. So I went over there. So he gave me a shot over here. Oh, my God. I'm perfect. I think I'm going to get back in the ring. So that's enough talking for me. He's got a lot to let you know something about your health and when to see. We're talking about arthritis, So Dr. Samuel Puleo from Norristown, Pennsylvania. Doctor, tell me something about yourself.
First of all, Hank, it's a pleasure to be on your show.
Well,
as you know, I always call you.
You're a good-looking guy too. You got a nice suntan,
Back from Florida. Yeah, as you know, you're a Norristown icon. I've known you forever, but it's a real pleasure to be here. What I'd like to do is to inform the audience about the various techniques that we use nowadays for hips and knee replacements. As you know, I was born and raised in Norristown. I went to school at Holy Savior. I went to PW High School. I did my training in the Philadelphia area. I went to Jefferson Medical College like my father. I think you knew him.
Yeah, your dad.
And
it had its office on Hawes Avenue.
That's right. It's a pleasure to be back here practicing, seeing all my old friends and treating them and their families. But I think what I'd like to get across to the audience is what arthritis is. I mean, many of us are afflicted by arthritis. The baby boomers and,
if you don't have it, you're going to get it.
You're going to get it, most likely. What arthritis is damage to the end of the joint. Okay,
Right.
2 bones come together,
Right.
and they make a joint. If you ever looked at the end of a chicken bone or a turkey bone, you see that smooth cartilage. Well, that's what our joints are made of too. When that gets damaged, that's called hyaline cartilage or articular cartilage.
What do you mean? It wears out like, or?
And when it wears out or gets damaged in some way,
Oh, okay.
it causes arthritis.
Because of hitting.
You get bone on bone. And there's a
Bone
lot
on
of different causes of arthritis. Most of us get degenerative arthritis, and that's what you had. The wear and tear arthritis that comes with age.
Well, because when I was a policeman, I did the motorcycle, kicking it.
Right.
A lot of
Not only that, you were a
boxing.
fighter. You're a
doing
fighter,
that.
yes.
Yeah,
So you were,
I used all my bones and muscles.
that's right. But other people are afflicted by something called autoimmune arthritis, which is rheumatoid arthritis, where the body attacks itself. Those people often require replacements to continue functioning. The hips and knees.
Right.
But it is a condition that afflicts many of us, unfortunately, but we do have solutions now in today's
You do.
day and age, yes.
The latest, what's some of your latest things now? The latest things on your operations for knees. How about knees? Hips are more successful. I don't know if I want to use the word successful.
Well,
but more advanced than the knees.
there are different types of joints. The hip joint is a ball and socket joint. It tends to recover very quickly after a hip replacement, as you know.
Yeah.
The knee is a little slower. It's more of a hinge joint. It takes
maybe that's it. Yeah.
takes a little bit of time to get everything moving and get all the parts working. But I operate out at the new Einstein Medical Center, Montgomery.
Tell me about that. No, a lot of people don't realize that we have a hospital out there that's, top shelf.
State of the art. It's
Right.
a state of the art hospital. It's a beautiful physical plant, first of all.
Right.
But all the equipment is modern and up to date. Everything is electronic. The medical records are electronic,
right.
and it's really
You know,
it's a
Dr.
pleasure
Anderson,
to work there.
Dr. Anderson operated on me, and he did it with the machine there. What do you call it? You know, boop, 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 boop,
robot.
stitching, you know?
Well, the robot isn't quite in the field of orthopedics yet, but
don't do
it's
that.
soon to come.
Yeah?
Soon to come. But we're using all the modern surgical techniques where we move tissue less, we make smaller incisions. The prosthesis that we use, I'm going to show you in a few minutes, are all
All right, show me something now.
modern metal.
We got some things here.
All right, this is a knee replacement. Okay, let me just
That
show
is
you.
a knee replacement.
This is what a knee replacement looks like when it's in the body. I don't know if the camera can get that.
Yeah.
But what it is metal on the femur bone, which is the thigh bone, metal on the tibia bone, which is the leg bone, and plastic in between. Now, I'll show you how this works. After we make our skin incision, we get down to the bone.
In other words, you open like, right?
We open it up, move the kneecap
I
out
have
of
it
the way.
over here.
Yeah,
Right.
you have it over there in the hip. But this is a knee. We move the kneecap out of the way. We cut out all the arthritic processes on the end of
Get
the
that
bone.
out of there. That's the one that's the problem.
All the
Right.
bad cartilage is shaved off. And then
Right.
we shape the bone to accept the components. Now, this is the thigh component, the femoral component. We put that on there. It's glued on.
Glued.
We use a special type of glue called bone cement. The tibia piece, which is shaped like this, gets put down in the center of the bone. And then in between, we have the plastic. So what you have, what alleviates the pain is you no longer have bone-on-bone rubbing. Instead, you have metal on plastic, which doesn't have any nerve endings, and that's what takes away your pain. Now, the tough thing with the knee is you have to do a lot of therapy to get it moving again, but it comes.
That's a knee.
This is a knee.
Oh, okay.
So that's what we use for the knee. Now, the hip, what you have, we can show you with this design
I
here.
had the hip.
It
This
has,
is my hip.
yes.
I had one, and then eight years in between, and there was a lot of difference. Less pain, less stay in a hospital, less
That's right.
rehab and everything, you know.
That's right.
So go ahead.
You're right, we did change things over the 8 years between your two hips. Your first hip, we used cement, bone cement, just like we use in the knee. We use it in the hip, but we've now
Drive that in.
discovered that we don't need that anymore.
No?
We use a special metal that the bone grows into it. And this is a very typical
Oh, that.
example.
that
This is
here-
what you have in your new hip.
It grows in here. Well, this is real like sandpaper.
That's right.
So it's porous.
Special type of metal,
Right.
that's right.
It goes right in there.
It's made of titanium. You know,
And that drives in here.
goes right into the center of the bone, like I can show you here. We make a hole at the top of the bone. We take off the bad part of the joint. We mill out the center of the bone, take out all the bone marrow, and then we insert this.
And that there.
And then up in the socket, this is an example of the socket. We put this piece right up into the pelvis.
That's the thing that goes round and round.
Yes, this is the piece that goes up there. This is the plastic piece for the hip. I showed you the plastic piece for the knee. This is the plastic piece for the hip. So you have a plastic piece inside of the, what we call the acetabulum, or the acetabular component. You have this piece that goes down into the thigh bone, and then we have this ball here. It's a metal ball that goes onto the femoral
And
component.
that goes into that socket. That's where
Goes
the
in.
action is.
Yeah.
Yeah.
Now, during the surgery, we
That's-
take,
Boy, when you got that pain over there, oh my God.
it really was dramatic, wasn't it?
Oh, unbelievable.
You have the surgical pain, but you no longer have the arthritic pain.
No.
And that's held up pretty well for you, huh?
Yeah.
But
All right, and all right, now the hip. What the best time? Well, you go to your family doctor, and you start telling them you got a hip or anything, but then they have to recommend go to a specialist, right?
yeah, well, most people,
how's
most
that
people
work?
start out with arthritic pains. Everybody has aches or pains. You go to your family doctor. Generally, they recommend some X-rays, and that tells you the severity.
X-ray tells you.
X-ray tells you how severe the arthritis is. Now,
Yeah.
typically they'll start out with some medication, see if they can keep it under control.
Right.
If it gets to the point that you can't walk or you can't bear it, then
Yeah.
that's usually when I see you. They
Yeah.
refer you to me, and then we discuss these various operations.
Yeah. Well, you know, when I had this couple, 3 or 4 weeks ago, this pain was in the back, like here, and then on the hip, and I was saying, well, I don't know if I go see Dr. Puleo, my hip replacement, all I'm thinking about, you know, and we went, and it's your office is over there, on, where is it?
We're
107 West Germantown Pike, okay?
yes.
And in the same office, when you say, go get an x-ray. So I get down the hall, and I get an x-ray. By the time I get back into the examination room, it's up there. The x-ray was there, and you
Yeah.
told me that's what it is now.
Yeah, we have a digital
gonna give it a
X-ray.
shot.
We have digital X-ray equipment
Yeah,
that
so-
gets transferred.
So I turn over like this here, boom, didn't hurt. I says, well, how's this little shock going to help this, you know? 2 days later, it's gone. So, you know, well, you know, it works for me. It might not work for somebody else, but at least, you know, don't wait too long. Don't wait too long.
No, whenever you have pain, you should
know.
you should not wait. You should see your doctor.
You don't have to yet put up with pain. All right, now, a little bit more about that knee replacement. Why most football players? Tell me something about that.
A lot of football players tend to hurt their knees. Matter of fact, a famous football player from Norristown, Johnny Pergine, I'm sure he wouldn't mind me saying, has had 2 knee replacements.
Yeah.
The knee is, as I say, it's a little trickier to recover from. It's a little more painful. It's a different type of joint, but we are using all the modern techniques. You may have heard about the quadriceps sparing incisions and the smaller incisions, minimally invasive. We're using all those techniques, and people do recover quicker. As far as hospital stay, 2 days for both of these operations.
Yeah, that's right.
Whereas it used to be like a week to 10 days almost.
I know. The first time for me was 1 week, and then I would have to recover it with I was all by myself to do a little bit of exercise. The second time, I was in a room with 4 or 5 other people, and it encouraged me more.
Yeah.
To do what, take a step and whatever it may be.
I'm glad you brought that up, Hank, because we have a special program over at Einstein. It's called the Joint Restoration Program. As a matter of fact, it's one of the few programs in the area that have been approved by the hospital joint commissions for as a center of excellence for joint replacements.
Yeah. Well, now I got a question from the audience, and it
Okay.
says there, what's the recovery time for each surgical operation?
Well, the hip's a little quicker. As I say, you're in the hospital 2 days. Usually driving
hip,
the hip, usually driving by about 4 weeks. Back to work if you don't do any real strenuous work.
Yeah.
Usually back to work anywhere from 3 weeks to 6 weeks.
Right.
Usually by about 3 months, 3 to 4 months, you're playing golf again.
Yeah.
Maybe a little longer for tennis, but I've had some people get back to tennis in
How
about 3
about
to 4 months.
Wilson?
Right away, in your hospital room that night,
Oh,
if you can.
you want to start dancing, you know?
The knee replacement, probably a little longer, 6
Yeah.
weeks to drive, maybe about 4 months to play golf.
Well, all right, now I got another question from the audience from way up in the balcony.
Okay.
How can someone prepare for a joint replacement? Is there a way for him to prepare?
Absolutely, we have.
Like, you when you get the examination, then they'll say, well, you're going to have an operation. So what you prepare? What
Well,
mentally?
Mentally,
Number one.
Mentally, number one. You have to be
Don't
ready.
lose the fight in the dressing room.
That's right.
Right.
That's right. Exactly.
Yeah, go in there. Say I'm going to go there. The doctor's going to take care of me, because you can put yourself in a grave if you just knock yourself. You got to.
First of all, we have to have people mentally prepared. They have to want to have this operation.
Right.
So, I mean, that's foremost. But as far as what you can do physically, you can help yourself by doing some exercises. For the knee, for example, you can build your quad muscles, which are the thigh muscles. The hip, you can build your abductor muscles, which are the muscles that make your hip go out to the side. And we have special classes, pre-op classes where you attend.
Oh, yeah.
And they go over
For
all
before and after?
Before.
Oh, yeah.
And they go over all these exercises and things you can do.
Right.
Well, of course, eating a good diet, getting your blood pressure under control,
Keep yourself so you don't.
getting your blood sugars to normal level. Yeah, it all helps you when you get in
because
there.
you don't want to bump into any kind of problems during the operation.
That's right.
I remember my last operation with you were operating on my hip, and after it was all over, Dr. Belasco came to me and told me that during the operation my heart wasn't moving the way it should have been moving. He said he recommends I get a pacemaker.
Mm-hmm.
So I said that's what I need. I get. See, so you can see that you're looking at while you're doing an operation, you're looking to see what it's any kind of problems.
Oh yeah,
you know.
oh yeah.
See?
You're
So you're looking at the heart, you're looking at the breathing, you're looking at everything, you know.
That's
And,
right.
And you know, so this is one question from the audience that I want to know. I want to know because I have 2 hip replacements. Right? How long does a joint replacement last? Hallelujah.
Well, first of all, Hank, you're probably going to outlast your joint replacements.
Huh?
You're probably going to outlast your joint.
Yeah. Well, I'm doing
You're
pretty
gonna
good
go on
so
forever.
far.
But typically, I would say the modern literature states that in 20 years, 90% will still be functional. So that's a pretty good track record.
How much?
At 20 years, 90% will still be very
Oh my
functional.
God, 20 years.
Yeah.
Well,
And
I'm
some of the-
91, ba-da-boop, so I got about another 7, 8 years.
Another 10 years, we'll think about
Right,
redoing.
yeah, so don't worry about it. I don't know. That one guy says, boy, he says, when I die, he says, I want to eat a lot. You know, I want them pallbearers to get a hernia lifting up the casket, you know. So everybody has a different way
That's
they want
right.
to go, you know. So, all right, now, your office is located where?
Well, we're across from the Sweet Square Shopping Center, right next to the Friendlies. There's a row of offices back off of Hillcrest Avenue.
Right.
And our address is 170 West Germantown Pike.
All right. And your phone number, you know?
Phone number is 610
275-9400.
9400.
All right, look,
There you go.
call up here. Again, it's 275, no, 610-275-9400. Hello. Hello. Dr. Puleo, yeah, it's Hank Cisco. My hip's giving me a problem. All right, you want to see me? Okay, good. No problem, thank you. That's what I did. And I went there and you give me, I call you magician, I don't know.
Well, I wouldn't say that, but
So, all right, now, your office, you have an exercise place there for people exercise. Tell me about that.
we have physical therapy for people who are recovering from surgery, or if you can avoid surgery, many times physical therapy will help you to be able to do that. We also have an X-ray machine.
X-ray, right in their office now.
We have up-to-date digital equipment. We're a modern day office.
But you do your operations in Einstein Hospital in Germantown Pike, right?
Yes, yes.
Einstein Montgomery, not Philadelphia. Here.
Einstein Montgomery.
Okay,
that's
now,
right.
Tell me what the story is now. You used to do Montgomery Hospital, right? That's where I got my two, Montgomery.
Yeah. Well, as you know, Einstein made a merger with Montgomery, and they built a new hospital. So
that's what they
the
did,
two staffs kind of merged, and we have a brand new
That's
hospital.
why they call it Montgomery.
Yeah.
Norristown Montgomery, because it's Montgomery County.
Right.
Yeah, well, that makes sense, yeah. Well, I wasn't too happy about it, you know, because I was a policeman. I used to take people in there with the emergency wagon and all. And, but now I see that's so modern, you know, and just top thing.
It was a very good thing for the community.
Now, all right, who else is in your office?
My partner is Bruce Mankiewicz. So it's the two of us that work together.
Now, I didn't ask you how long you've been a doctor. How long?
Well, I started private practice in 1983. So that's...
Who was president then? I don't know.
I think it was Reagan.
I don't know. George Washington.
Yeah, George. So I've been around for a while.
Yeah. And so your office used to be at Main or Lafayette. No, what am I talking about? Finance.
We were at
Finance
the
and
Calvin
Yeah,
Finance, and
yeah,
then
yeah.
5 years ago we moved.
That's right. That's what my first meeting with you.
Right.
Yeah. Now, why? I'll get back to you. How come you became a surgeon? Because your father told you to? Your father?
No. I always wanted to be a doctor.
Oh.
Okay, from very, very young. We have a lot of doctors in my family, and I always thought that would be a nice.
What do you mean you have a lot of
Profession.
doctors? Who?
Well, my uncle Anthony was an anesthesiologist, my father's brother. I have a couple doctors on my mother's side, practice in New Jersey. My uncle Vince is a dentist, so we had a lot of people in the medical profession. But when I went to medical school, I started out in medicine. And
Medicine.
and I wasn't quite sure I made the right decision, you know. It just didn't seem to fit with me. But then when I did my surgical rotation, I said, that's it.
That's it. You want to be a surgeon.
This is what I need to do.
And
So
and where'd you start out?
Jefferson. I went to Jefferson,
Right.
Medical College.
All right. Here's another one. You read this one from the audience.
How has the field developed over those years? Well, I would say certainly the materials that we use in orthopedics are very changed over the original materials. They last much longer. They're more durable. There's hardly any failure of material these days.
In other words, the equipment, or not equipment, what do they call it?
The actual materials and the instrumentation that we use to put these in has dramatically changed.
Right.
It's much more sophisticated. The other thing is we're getting super specialized nowadays. People are doing, instead of a lot of operations, people are doing just a few operations. So it enables.
What do you mean by that? I don't know.
Well, like for example, someone may do special training, and when they come out of orthopedic surgery residency, they may do special training where they're only doing maybe 4 or 5 operations of certain types, like knee replacements, hip replacements. Other specialists go into sports medicine. Others go into tumor oncology, where they take bones out that are cancerous and put in different materials to enable people to walk. So things are really becoming super specialized, which enables that individual doctor to concentrate on a small area and become a true expert.
Right. Now, I like to you were talking about before the show that you'd like to come back here and talk about with another doctor. Tell me something about that.
Well, we can do, we were talking about maybe doing a symposium where we pick a topic and we have different input from different specialists. I think that would be very educational.
Okay, how about this?
anytime you
Another question from the audience. Hit it.
What would you say to someone who is afraid to get a joint replacement? Well, a lot of people are afraid. It's a major operation, and you can't blame people for being afraid to have a joint operation. But I think people should be more afraid of not being able to function. Because when you can't walk, you lose your health.
What's going to happen if you don't get it?
That's right. I mean, everything you do, Hank, you have to be able to walk.
Right.
You go on vacation, you got to be able to walk.
Right.
You go to the shore, you got to be able to walk. You go shopping, you got to be able to walk. And when you're not able to walk, it affects your general health.
Right.
But I would say become more educated. Read about the procedure.
Yes, right.
Read about what it can do for you, how it's going to change your life. Most people tell me they waited too long.
Yeah. Well, an informed nation is a healthy nation.
That's right.
Be informed. Find out. Just like what we're talking here today. It's going to open some doors to say, well, geez, I didn't know that. I didn't know that. You know. So now here's one other question about rehab.
Which is better, home rehab or rehab facility, physical therapy? I personally favor home therapy, to be honest with you. Yes, I do.
All right, tell me more about that, because that's a big thing.
Well,
especially people don't like to be going into
that's
places,
right.
you know.
And
it's good to hear you say that. See?
I personally encourage people, if they have the right situation at home,
Yeah,
that
yeah,
is,
yeah.
to go home. First of all, there's no place like home.
Yeah.
You go home,
Hello.
you're eating your own food, you're sitting
Right.
in your favorite chair, you
Mind your
sleep.
spaghetti, ravioli, you know.
There you go.
Right?
You're drinking your own wine, right?
Right, yeah.
You're sleeping in your own bed, and you can do things on your own schedule. I think people will just feel a little more relaxed once they get home.
Yeah,
And the way we have it arranged now with home care, they come to you for 4 weeks.
Yeah.
If you go to a rehab center, you're at the mercy of their schedule as far as
Yeah.
getting up and having therapy.
Right.
But some people, I would say maybe 80% of people can go home.
Oh, yeah.
But some people can't because of a home
Yeah,
situation.
yeah.
They don't have enough help. But I would really, I personally feel that home therapy is better.
Yeah. I think you always, there's nothing like, it's just like you say, nothing like home, you know. And, but you know, you're a local guy. You know, everybody they think, well, oh, I got to get an operation. Oh, I got to go to New York. Oh, I got to go to Philadelphia. Come on. We have the top doctors, top hospital right here in our area, you know, and all you got to do is make a phone call, right?
Plenty of expertise in our
Right,
area.
right.
Plenty of expertise.
Now, your training, has the training changed since the time you were in school?
Yeah, they don't work as hard. They don't work as hard.
Yeah.
They've limited the hours that the residents can work.
Yeah.
But it's basically the same. What it takes to be an orthopedic surgeon, for example, you have to go 4 years medical school, and then a year of internship. In my case, I did a year of general surgery internship, and then 5 to 6 years of training in the hospital before you can
Right,
go out in
right,
private
right,
practice.
right.
So,
Okay.
it's a very rigorous training.
The 30 minutes is over, and
Already?
give me 30 seconds. Tell me, we talk about maybe afraid to get an operation or anything. 30 seconds. What would you do?
Get more informed. Get more informed.
Okay.
Look
Check.
into it. See your doctor. Talk to your doctor. Nobody's going to force you into an operation.
Right now, call this number 610-275-9400 and say, look, I think I got a problem. Can I come up and see it? That's the name of the game. Okay?
Thank
So, Dr. Samuel Puleo, here's a little thank you for coming on my show.
Thanks,
All
Hank.
right? And
That's great.
I
Put
really
that right in my
appreciate that.
office.
Okay?
Thank you very much, Hank.
Thank
Good to
you.
see you again.
And, if you're a little afraid, there's nothing wrong with a little bit of a Hail Mary, too. That'd help out, too, you know?
That's right.
Before and after the operation. So until we meet again, thank you for allowing us to come into your home. And I hope that this helped you open some doors, that, know what's going on out there and what's new out there. Okay? Thank you very much, and may God bless each and every one. Adios, amigos. Grazie. Right?